As our experience around COVID begins to unfold almost 1 year on, there is some amazing information on countries that have been very successful in handling the COVID crisis. And the question is, why? Recently, several papers have come out looking at the incidence of coronavirus and countries affected by malarial infections. And it reports the countries most affected by malaria showed fewer or no cases of COVID. One possible explanation of the limited spread of COVID-19 in countries affected by malaria is the wide use of anti-malarial drugs. It's true that in countries like Vietnam and some of the African nations, they have been quite successful in bringing down malarial numbers. Vietnam has reached a threshold where it's effectively controlled malaria. Vietnam is exceptional for having only 3 or 4 deaths attributed to COVID-19. They have grappled with their malaria problem aggressively over the last few decades. So let's take a look at a world map of data presented by Our World in Data, which has a really wonderful visualization tool. So here's Vietnam's death rate, 0.36 deaths. And when we click on the country, we can indeed see that their curve has definitely flattened. When we look at the neighboring country of Thailand, we see a similar picture, remarkably few deaths per million, not even one. Again, a fairly flat and successful story here. Both Thailand and Vietnam's curve is essentially flat. And again, if we look at China's curve, we see that it is effectively flat. Let's look at Australia, a comparable nation. They had a few issues in the beginning, but it seems to be relatively under control. Now, when we compare the numbers for Europe, Spain recently passed an important benchmark of over 1,000 deaths per million. The United States is not far behind at about 960, comparable to Mexico. So, when we map what these countries look like from the perspective of placing malarial incidence and COVID-19 together, let's have a look and see what we get. So here's the map of malaria, and when we overlay the COVID deaths per million in an inverse colored data map. So in other words, the countries with the lowest amount of COVID will use the same color as the countries that have the highest incidence of malaria. We begin to see a striking similarity. Incidence of malaria, incidence of COVID. The relationship is striking. There are some countries that are anomalous. Australia having almost no malaria and being very low in their COVID death rate. China is similar, extremely low on both counts, as is Vietnam. But it's in the African countries you really start to see this relationship stand out. The countries with the highest incidence of malaria have the lowest incidence of COVID. So what's going on? One of the most commonly used anti-malarial drugs is derived from a plant that bears the name of a goddess, Artemesia. The compound is called artemisinin, and it's usually synthesized into dihydroartemisinin and a compound called artesunate in tablet form. However, the natural version of the plant isolate is registered with Health Canada as a natural health product. It's essentially classed as a supplement because it's that safe. So we have a compound that is widely used as an anti-malarial that has shown to be effective and safe in treating that by millions of people over decades. So what else is going on? Well, it turns out there's a side effect to these anti-malarial drugs. Artemisinin belongs to a class of compounds that are known as PAK1 blockers that also interfere with the virus's capacity to replicate, and not just COVID-19, but many other viruses as well. Another compound in the same class, ivermectin, derived from a microbe in dirt. Plants have had to coexist with pathogens and virus for millions of years. It's been an evolutionary arms race. So the plants have developed specific molecules that target systems in these pathogenic viruses. There's a different effect on viral replications. Many of these viruses, like COVID-19, use an enzymatic pathway called the PAK1 kinase. It's a cascading signaling system that uses chemical messengers. You could think of it like a train switching yard. The PKA1 monitors incoming traffic and directs it here and there and amplifies signals down the line. Mice have been genetically designed to not have this pathway, and they do fine. In fact, in some ways, they seem healthier and live longer than their unmodified counterparts. So we may have discovered something really amazing here. For a pathogenic human virus to infect cells, replicate, and disseminate, it must exploit the signaling machinery of the host. Many viruses also find ways to activate cell survival pathways and to alter host transcriptional programs to prevent premature apoptosis of the infected cell. So PAK1 kinases play several crucial roles from the standpoint of a virus. The virus uses the machinery of the host cell to replicate, and it also tries to modulate immune response so that the immune system does not target the infected cells before the virus has a chance to replicate. And that is what makes the development of PAK1 blockers so exciting, and the fact that we've discovered a naturally occurring one is remarkable, to say the least. This journey has been incredible, that a plant named Artemesia is here to help us in dealing with our most difficult human problems at this point. Artemisinin is very safe. It's also poorly absorbed by the body, so you have to take enough to raise blood plasma levels to the effective level. There are other plant compounds that have been shown to increase the bioavailability and effectiveness of artemisinin by 4 to 10 times. And there is a product called Artemene that employs these other plant compounds along with an effective dose of artemisinin. I want to make this available to people, so here it is.